Hello, everyone, and welcome to Kutsu Academia. Today, we're going to talk about something you see all the time. Maybe it's even in your own medical history, a penicillin allergy. But what if I told you that for the vast majority of people, that label is actually wrong? So, if you look at the raw numbers, it seems pretty widespread. About 10% of the entire US population says they have a penicillin allergy. That's a huge number. We're talking over 32 million people being told to stay away from one of our most important antibiotics.
But here's where it gets really interesting. This is the gap between what people think and what's real. When you actually test all those people who report an allergy, well, the research shows that over 95% of them are not allergic at all. Let that sink in. The overwhelming majority can take penicillin perfectly safely.
Now, you might be thinking, okay, so what's the big deal? I'll just use a different antibiotic. But it turns out this huge misunderstanding has really serious consequences, not just for you as an individual, but for all of us. Okay, first up, let's dive into the actual dangers of having that incorrect allergy label on your chart, because once that's there, it changes the entire game plan for how doctors treat you. So this puts doctors in a really tough spot. You see, penicillins are often the absolute best tool for the job. They're safe, they're super effective, and they're targeted for specific infections. When a doctor can't use them, they have to reach for alternatives, and those are often broad-spectrum antibiotics, which can be less effective and come with a higher risk of side effects. And avoiding these first-choice drugs, well, that leads directly to a much, much bigger problem. Studies have actually shown that patients who are labeled with a penicillin allergy are at a higher risk of getting some really nasty infections, like C. diff or even resistant bacteria like MRSA. And that brings us to this huge global threat, antimicrobial resistance. Basically, every time we use a big gun, broad-spectrum antibiotic when a more targeted one, like penicillin, would have done the trick, we're giving bacteria a chance to learn and evolve. We're putting pressure on them. In other words, these mislabeled allergies are literally helping to create the superbugs of tomorrow. So the big question is, how did we get here? How did so many of us end up with the wrong label in our medical files in the first place? Well, the answer is pretty fascinating. Okay, so a true immediate penicillin allergy, the kind we really worry about, is called an IgE-mediated reaction. This is your classic allergic response, with hives, swelling, or in rare cases, something really serious like anaphylaxis. But here is the absolute kicker. This kind of allergy is not always for life. Our immune system's memory can actually fade over time. For people who had a real, genuine reaction, studies show that after about a decade, roughly 80% of them lose that sensitivity. They can tolerate penicillin again with no problem at all. The allergy literally just disappears. And on top of that, a lot of these so-called reactions were never really allergies to begin with. Think about when you were a kid. You got sick, the doctor gave you amoxicillin, and then you broke out in a rash. Well, it's way more likely that the rash was actually caused by the virus you were fighting, not the antibiotic. Other things get mixed up too, like mistaking a side effect like nausea for an allergy, or just assuming you have one because your mom does. So, if you're one of those millions of people with this on your chart, especially if it was for something that happened ages ago and wasn't that severe, how can you find out the truth and do it safely? Thankfully, there's a really clear and safe process for this. It all starts with talking to an allergist who will go over the history of what happened. If you seem like a good candidate, they might move on to a simple skin test. They just apply tiny, tiny amounts of penicillin to your skin. If that's all clear, the final step is what's called an oral challenge, where you actually take a dose of the medicine while you're being monitored by the doctor. And you should know this whole process is incredibly reliable. A negative skin test means there's a more than 95% chance you are not allergic. It's not just a guess, it's a super well-established and safe medical procedure. When you add in a successful oral challenge, that certainty gets pretty darn close to 100%. Getting this label taken off your medical record isn't just, cleaning up your file. It's a huge step towards getting better healthcare, not just for you, but for everyone. When it comes right down to it, getting tested and delabeled means you get access to the best possible antibiotics when you need them. And that usually means you get better faster, with fewer side effects, maybe even shorter hospital stays and lower medical bills. And you'll be doing your own personal part in the global fight against antibiotic resistance. It's a win-win. So maybe the next time you see your doctor, it's worth asking this question. A really simple conversation could be the first step to getting safer and more effective medical care for the rest of your life.
Kitsu Academia, please don't forget to subscribe and like.